Good afternoon. My name is Marty Acevedo. I am the president of the board of directors for Parkinson's Association San Diego. I do a lot of other stuff too that you'll hear about as we go forward. I am a person with Parkinson's. I was diagnosed in 2004, 19 years ago. So this is what you can look forward to. In some cases, we're all different. Each one of us has a different path on our journey with Parkinson's, and you'll learn a lot more about that. But for me, Parkinson's opened the doors to so many things. It gave me a voice, and it helped my life to be improved in a great extent. A lot of that's from having a positive attitude. Positivity can lower the rates of stress and depression. Stress makes every single Parkinson's symptom worse. Every symptom. Gratitude and mindfulness really helps to be thankful for each thing that you have in your day. These are good things for anybody to practice, but with Parkinson's, if you've been dealt with a chronic illness, it was really helpful to focus on the good things and not so much on the things that are negative, not focusing so much on, wow, I'm really stiff this morning when I got up, and how am I going to get through this day, rather turning that around to, wow, I'm getting up today, and I have a full day ahead of me, and then I can feel better if I take my medications and move. As I just said, you can change a bad day into a good day, just all with attitude and acknowledging that there are many, many, many things in your life that are positive. Your family, your support, your care partners, your friends, and you're in control of your mindset and how you choose to live your life. Parkinson's, as I said, the diagnosis is life-changing. But at this point in our journeys with Parkinson's, there's more resources and more tools in that toolkit for our movement disorder neurologists to manage our illness and our condition than there ever has been before. There's more research out there. There's biomarker that's out there, and there'll be more to come. So it's actually, if there's ever a good time to have Parkinson's, it's now. Meditation, I'm terrible at meditation. I can't just sit there and just let thoughts come through my mind and then let them go through. But you can really change your attitude by practicing meditation. Think about it maybe when you're walking or when you're riding your bike, or if you go to the beach, just noticing the things around you, the birds, the sound of the ocean, the smell of the salt water, those types of things. So, some of you have been told that you have Parkinson's, and some of you are care partners and loved ones of someone with Parkinson's. So let's all take a very deep breath. And another. Calmed me down. That's what I do when I go to the doctor's office to get my blood pressure going down, because it goes up when I go in and see that white coat. But try breathing every day. Try just working through the feelings that you're having by just breathing. It really does help you to feel better. One of the things that's really important as you start your journey with Parkinson's, and as it goes on, it will change over time, but it's to develop your care and your support team. You as a person with Parkinson's are at the center of that team, not your doctor, not your husband or wife, not your physical therapist or dietitian. You are the one who knows the most about your Parkinson's, because we're all different. We have different symptoms, different rates of progression, different response to medication and treatment. So using those things of a positive attitude, find a purpose in your life. When I stopped working 9 years ago, I got involved with advocacy and helping other people deal with their diagnosis of Parkinson's. It's given me, as I said, a voice and a reason I get more from helping people than they get from me. Practicing mindfulness, exercise, I can't tell you how important that is in the management of your symptoms, and our physical therapist, Jesse, will talk more about that, as will probably our movement disorder neurologist, Brent Wright. He'll talk about exercise. You'll hear it throughout our day today. And then socialization is critically important. If you don't have the support and you don't get out and talk with people, Parkinson's is a very isolating disease, And we tend to be embarrassed at first, perhaps by our symptoms. Don't want to go out and have people look at us and think, why are they looking at me? Are my symptoms noticeable? It's really helpful to socialize in events like this, support groups. We have a big walk that we have about 1,100 people that come to. It's just a day of joy with all the people that are out there celebrating life and their life with Parkinson's. So members of your care team include, we would really encourage you to, after your diagnosis, get a referral to see a movement disorder neurologist. Brent will talk more about that, but a movement disorder neurologist is a neurologist who specializes in movement disorders like Parkinson's, essential tremor, Huntington's disease, and others. That's primarily all they see. So they know more about Parkinson's than your regular neurologist who might specialize in headache or stroke or some type of seizure disorder or those types of things. There are nurse practitioners. We have about 15 movement disorder neurologists in San Diego County. There's a nurse practitioners that specialize in Parkinson's and movement disorders, PTs, occupational therapy, speech language pathologists, dietitian, as I mentioned, the case managers, social workers, and on and on. And then your care partner is a very, very important part of your team. They need to understand what's happening with you. They won't understand exactly what's happening, but they need to understand how to respond to what you're feeling. So now I'm going to introduce Dr. Brenton Wright. He's a movement disorder neurologist I'll let him continue to give his introduction because he does a lot of things for us. And Brenton Wright.
Hi, everybody. Just some quick housekeeping real fast. If everybody could turn their cell phones on silent, please. Okay, you guys are here because either you or a close family member or friend has been given this diagnosis of Parkinson's. So this whole day is to give you, your doctor doesn't have enough time to adequately talk to you about this in the hour he or she had with you. They get your story and they have to examine you, and then they have about 5 minutes at the end to explain things to you. So this is what we're trying to do. This is a very complicated disease, and we're trying to explain to you what it is and how to get started. So what is Parkinson's disease? Parkinson falls into the category of a neurodegenerative disease. That means it starts off with very subtle, some people call insidious symptoms that are very mild and maybe rare at first, and then over time they become more noticeable and more frequent and sometimes more annoying. So unlike a stroke, which is a blood clot in one of your branch arteries of your brain that happens all of a sudden and very quickly, and then it's an isolated event and you have a little bit of a recovery and you shouldn't get worse as long as you don't have another stroke. These diseases gradually get worse over time. And so another example of neurodegenerative disease is Alzheimer's disease. Huntington's disease is another one. ALS is another one as well. So they're slowly progressive diseases. This is a disease that it affects a lot of parts of the brain and the body, but we know that the earliest part that seems to be affected is the dopamine neurons in your brain. These are neurons that help you move. They don't actually help you generate the primary force. That's what often gets affected in a stroke or spinal cord injury. You lose the ability to generate force and you become paralyzed. Parkinson's affects a different system. You don't become paralyzed, but your ability to do your movement smoothly without any extra movements like tremor or twisting muscle spasms gets impaired by this problem, because this is an important circuit in the brain that helps you move. So, as I said, in the early stages, it's characterized by the loss of these dopamine neurons, which live in your brainstem, and they send up processes called axons up to your striatum, the putamen and caudate in the brain, and they release that dopamine there. And in the normal state, when there's a steady state of dopamine, You're able to move smoothly and swing your arms normally and have a nice rhythm to your movements. You have normal facial gesturing. You swallow your saliva without having to think about it. And so when you start having loss of these dopamine cells, you start noticing these things. You might not swing your arms as much, or you might not swing one of your arms as much. You might have that, what we call the masked face of Parkinson's, like a poker face. And then you might notice that you're shuffling your feet when you're walking. Your rhythm is off. So by the time people develop these symptoms, about 30% of the cell bodies have been lost, and about 50 to 60% of their axons and the amount of dopamine that's up in the target area, the striatum, has already been lost. And so we think that this disease starts many, many years before people develop their motor symptoms, their tremor or their slowness or their lack of arm swing, and that their body is compensating it for these 20, 30 years. There's quite a bit of damage that's been done by the time people get a diagnosis. And so that's one of the reasons it's been so challenging to find a good treatment to slow down these neurodegenerative diseases or hopefully cure them, because we think that they're going on even before people are presenting to the doctor. Okay. So is Parkinson's a genetic disease? This is a very complicated question. It is a genetic disease. We think that probably for about 85% of people with Parkinson's, they have what we call multiple genetic polymorphisms that are contributing to make them more susceptible to the disease. Now, about 15% of people with Parkinson's have what we call a monogenic Parkinson's disease. That's caused by one specific gene that you can test for that has a mutation in it, and we can attribute that mutation of just that gene to causing their Parkinson's. And so that's about 15% of people right now, according to medical science. Now we may discover new genes. The most common genes that are out there that cause Parkinson's are the GBA, glucocerebrosidase gene. This has just been, in the past few years, been found to be the most common cause of monogenic Parkinson's disease. And anywhere from 5 to 15% of people with Parkinson's have this gene mutation. It's an autosomal dominant mutation. If you have 2 copies of it, you get a disease called Gaucher disease, which is a disease that presents in childhood with bone problems and seizures and developmental delay. People that have 1 copy of it are more likely to get Parkinson's. And then there's another disease called the LRRK2 gene, which is about, we think about 1 or 2% of people that have the normal late onset 70s, 80s onset Parkinson's, but it can be more common in other certain populations, like Ashkenazi Jewish population has more common of this gene. And then there's some more rare genes. There's a gene called Parkin, which is autosomal recessive and more rare, and it's the most common cause of genetic young onset Parkinson's, which is Parkinson's which starts before age 50. And so the answer is yes, there is genetic component in Parkinson's. But we think that for most people, at least according to medical science right now, 85%, they don't have one of these known named genes. They just have a collection of different polymorphisms in all their genes that make them more susceptible to getting the disease. We think maybe from some kind of more environmental insult. We know there's certain things like pesticides and industrial solvents that can put you at risk for Parkinson's. And so nobody's exactly cracked the case of exactly what causes it. But there's a lot of really smart researchers working on this. Another thing to emphasize, even though as doctors we lump people, it's easier to lump people into categories and say this person has tremor dominant Parkinson's disease, this person has, a different Parkinsonism. Everybody's Parkinson's is unique. Some people have tremor, some people have no tremor. Some people start in their dominant hand, some people start in their non-dominant hand. Some people have both sides affected from the beginning. Some people shuffle a lot, some people fall a lot. So it's really, you have to take it as it is, how it affects you. And you have to, as she was saying, Marty was saying, you have to really be your own expert on your own disease because you're the one that knows everything that's living with it 24/7. All right. Well, Parkinson's disease, had a lot of patients that come and say, well, I don't like taking medications. Well, unfortunately, Parkinson's disease involves a lot of medications. Chief among those are the medications that are treated for the dopamine replacement. The main one is called carbidopa-levodopa. The old brand name is Sinemet. The active ingredient is levodopa, which your body turns into dopamine via a chemical reaction. And the idea of that is for your doctor to find the right amount of medication to get your dopamine levels in your brain back to the normal level, and so that your symptoms are relieved and you feel better. And then also to assess how long the effect of that medication lasts, and so how often you need to take it throughout the day, how many hours apart. And that's one of the main things that your Parkinson's neurologist will be doing. There's a variety of other medications. Rytari is an extended release formulation of carbidopa-levodopa. There's a CR form. There's a class of medications called MAO inhibitors that make each levodopa dose last just a little bit longer. Azilect, Zelapar, and Xadago are examples of those. There's a class of medications called COMT inhibitors, which inhibit one of the other enzymes that break down dopamine in the brain and make each dopamine dose just last a little bit longer. Comtan, Tasmar. I think Ongentis actually got pulled from the market actually recently. They have it in Europe. There's medications called dopamine agonists that are similar to levodopa molecularly, but are slightly different synthetic molecules, and they can work as well, very well. Amantadine, people often take for tremor, or they have these problems called dyskinesias, and it helps suppress that. Beta-blocking drugs for action tremor, like propranolol or Inderal. And then there's old medications from the 1940s and 50s before we discovered that Parkinson's was mediated by dopamine that are anticholinergic medication. Sometimes they can help tremor and dystonia, but they usually cause a lot of side effects in older people, very old medications. And there's many other medications as well. These are the ones for the motor problems, but people with Parkinson's get a variety of non-motor problems like constipation and depression and things like that. And so there's medications that are used to treat those symptoms too. Right, the non-motor medications like the antidepressants or SSRIs for depression and anxiety, both of which are very common in Parkinson's. Stool softeners and promotility agents for constipation, which is very common in Parkinson's. Overactive bladder, medications that can help with that. Some people get a problem called orthostatic hypotension where their blood pressure drops when they stand up, and they actually have to take medications that artificially raise their blood pressure so it doesn't drop so much that they faint. And later on in Parkinson's, people can get problems with it, their cognitive function, and they can sometimes have hallucinations, and there's medications that are used to help suppress those hallucinations. The main one that we use these days is called Nuplazid, and then there's some older ones as well. This is more for people that have had PD for a number of years. These are what we call the advanced therapies for the motor symptoms. Often these are for patients that respond to the PD medications with their movement problems very well, but their medication is not lasting as long as it used to for them, and because of that, they're having to take more and more. So they start having problems called dyskinesias, where their body might kind of wiggle around involuntarily, and it can be very hard to balance not being able to move, which is their low dopamine state, to dyskinetic state, which is their high dopamine state. And so some of these therapies can really help smooth out the response. Deep brain stimulation therapy is where an electrode is implanted into a very specific part of the brain and delivers, is almost connected to something like a pacemaker, and it delivers high frequency stimulation to that part of the brain and kind of disrupts the abnormally coupled hypersynchronous brain circuit that's caused by the low dopamine state. And so it helps the movement problems, and so it can really smooth out people's movement response. Focused ultrasound is a similar concept in that it involves targeting a specific part of the brain that's involved in an overactive circuit. So that is an option that's available out there as well. Doesn't involve an incision and doesn't involve any hardware in the body, The difference between DBS is adjustable and the focused ultrasound is not adjustable, but it's a good option for many people. There's a system called the Duopa system where people have a dopamine gel and they're actually continuously receiving the drug in their gut via this pump, and it allows them, instead of having the peaks and valleys in dopamine blood levels from taking a pill, it allows them to have a smooth level. And so that can work very well. And then there's a subcutaneous levodopa infusion pump, which is a little bit less bulky. And at last I heard that the FDA had some trouble with the hardware in the pump, but we're assuming that's going to get approved by the FDA pretty soon. So that's another advanced option. You know, there's a lot of smart people doing research out there trying to figure out what causes this disease and how we can find ways to stop it and slow down the progression and all sorts of things. So if you're ever interested in getting involved in research studies, all the help we can get is very appreciated. One thing I'll mention is that in almost all research studies, the people that are involved are 95% Caucasian. So, you know, when we do research on only one group of people, we don't know how other groups of people actually respond to things. So it's really important to get some, you know, non-Caucasians in these research studies because we have really low percentages. And, you know, we can't, it's not good to generalize this information to everybody when it's really done on one group of people. And that's actually a problem in medical research across the board in every disease. If you go to clinicaltrials.gov and you can search for Parkinson's, you can see where clinical trials are going on all over the world. There's on the Michael J. Fox Foundation website, there's something called the Fox Trial Finder, which is very cool. You can type in your information and they can put you together with people close by. At UCSD, they have the Parkinson's Progressive Biomarker Initiative, and looking for molecular and quantitative tests to try to track the progress of Parkinson's, and that's a good option. And the VA has clinical trials too. So San Diego is a great place because there's a lot of doctors here and a lot of scientists working on these things. Okay, I think this is. By the way, this is like a whirlwind of information, so we don't intend for you guys to get totally overwhelmed, but that's why we record this and we have it on the website so you can go back and see this stuff.
So as your Parkinson's progress, there may be a need for you to have to go in the hospital for something else, like a hip replacement or a knee replacement, or you have an accident, you have some reason that you need to go in the hospital. And it's not safe for people with Parkinson's to go in the hospital because our caregivers don't see very many of us. There's not a lot of people. There's only about 1 million people in the U.S. with Parkinson's, so we're a rare disease. And healthcare professionals just don't see a lot of us. They see a lot of people with stroke and trauma and heart attack, but they don't see a lot of people with Parkinson's. So they don't always understand that the need for our medications to be given and dosed on time, every time, and the right dose, according to our home schedule, is very critical to us, and it can really impact how we live our lives and our response to therapies and such. And at times, people with Parkinson's they decline to the point where they are not able to go home after hospitalization. They might go to a skilled facility, a rehab facility, and then home, or to a skilled nursing facility. So what we've done to help with that is we're developing a Parkinson's Medical Safety Needs Toolkit. It will be on our website in the next month or 2 or 3. And it includes instructions on how to use the forms. There's a letter that you would take it with you to the hospital, or if you're having a surgery that's planned, you would take it to the pre-op nurse. Or if it's an emergency and you've fallen and you have something that you're seeing someone urgently for, you would give this letter to the people that are admitting you in triage and the ER, and then repeating what's on that letter to every person that you see in the ER, so that they understand that you have Parkinson's, and it's important that you get your medications on time, every time. Hospitals don't, the staff at a hospital don't come in and say, I'm not going to give the Parkinson's people their meds at the wrong time. They don't do that. But there are systems and policies and procedures because they have, a nurse has 5 to 7 patients on a regular floor, and she has to attend to their needs as well. So they have systems where medications are given at set times throughout the day. But a person with Parkinson's who's more advanced might take their levodopa medication at 5 in the morning, at 8:15, at 10:45, and on through the day. And if they are off by 15 minutes or so, that might cause them to get their symptoms to return, or them to have some complications related to not getting their medications on time. In this packet, there's also information about deep brain stimulation if the person has had it. I've had deep brain stimulation, so when I was at an ER a year or so ago, I said to the EKG tech, they wanted to make sure that I had had a fall, that it wasn't cardiac related, so they wanted to see my heart rhythm. And I said, well, I've had deep brain stimulation. Do you want me to turn it off? Because it's going to affect the rhythm that you'll see. And she said, oh, no, it'll be fine. It wasn't fine. It was terrible. There was a lot of artifact on it, and they diagnosed that I had had an old heart attack, which wasn't the case. I never have had any heart issues at all. But it just was confusing to them because they didn't realize that this was the device, mine is on this side, would impact the reading that they get from an EKG. So there's information on DBS and how to have surgery, all the things that you need to do to take precautions with that. Same with Duopa that Dr. Wright mentioned, the intestinal gel that's infused continuously. There are precautions that need to be taken with that as well when you're in the hospital. There's a medication list with the time and dosing information for what you do at home. Special considerations for Rytari, which is the newer form of Sinemet or carbidopa-levodopa that's out. Your personal contacts and your medical contacts, including the person who takes care of your Parkinson's symptoms. In my career, I am a registered dietitian, so that's what I did for 35 years. So I would be remiss if I didn't talk a little bit about diet and nutrition, and I don't like the word diet because if you go on a diet, you're going to go off a diet. So I like to say lifestyle instead, which means in the Mediterranean mind-style lifestyle has been suggested to be helpful for people with Parkinson's because it contains antioxidants and phytochemicals that may help to reduce inflammation and may help to reduce the damage to cells from normal metabolism. And there's thought that these things can help to manage symptoms more effectively. A Mediterranean lifestyle by nature is more seafood, more plant-based foods, less red meats, whole grains and pastas, which help with your constipation if that's a symptom that you might have. Fresh fruits and vegetables, they have the antioxidants that I mentioned and phytochemicals. And also they have fiber, which is helpful. Nuts, herbs, and spices have some pretty cool properties that can help with managing symptoms. Red wine in moderation. Don't start if you don't drink, but if it's okay with your physician, red wine in moderation and with a meal. My favorite, dark chocolate, has some really good antioxidant properties. And then if you think about it, people who live in the Mediterranean area of the world, they relax, they practice mindfulness, that I mentioned earlier, and they exercise regularly. Exercise is the only thing that we know that can help to slow the progression of Parkinson's, so it's really important to incorporate that into your lifestyle. This is more on phytochemicals and antioxidants. As I said, they might reduce inflammation and aid the immune function that happens in our body. Green and black teas, curcumin, which is something that's found in curry and mustard, fiber, garlic, carotenoids, and beta-carotene. That's things that are found in yellow and deeply colored fruits and vegetables. And then antioxidants help to protect when the body goes through the cycles that metabolizes our nutrients. things called free radicals can form, and the antioxidants protect the cells from damage that can be caused by those free radicals. And antioxidants are found in fruits, vegetables, berries and grapes, dark chocolate, pomegranate, cranberries, and the omega-3 fatty acids, which are deep water fishes and nuts. So Jessie Agremas is our doctor of physical therapy. She's going to talk to us about why exercise is so important and also about the therapies that are available to people with Parkinson's.
Perfect. Cool. I can do it. Okay. Hi, everybody. So as Marty mentioned, we're going to talk about exercise, physical therapy, speech therapy, and occupational therapy, and why it's so important for somebody with Parkinson's to do these things. So exercise is important for people with Parkinson's because it helps to maintain balance, mobility, and the ability to perform daily routines. Exercise and physical activity can improve many Parkinson's symptoms. And aside from just improving these symptoms, both motor and non-motor symptoms, as Marty mentioned, it helps to delay the progression of Parkinson's disease. So there's all kinds of ways to medically manage Parkinson's to help with symptom management, but exercise is the only thing that slows the progression and is disease modifying. There are 4 different categories of exercise that are important for someone with Parkinson's disease to be doing. So we'll go over these 4 categories a little bit. The first one is aerobic training. So this is like our kind of steady state cardio or even doing some interval training. These are things like walking, swimming, running, cycling. Whatever way you enjoy doing aerobic exercise is great for someone with Parkinson's to be doing. The goal is to achieve 150 minutes per week of moderate intensity aerobic exercise. So if you think about a scale from like 0 to 10, where 0 means it's really easy and 10 means it's so hard, time to take a break, you want to try to get to about a 4 to a 6. But that's the goal. You can start wherever you're able to start and then work your way up to that. And then when people are able, we also push higher intensities as well. Next, we'll talk about strength training. So you can use dumbbells, you can use kettlebells, you can use body weight, you can use exercise bands. But strength training is really important and it should be progressive. So with all of our categories of exercise, it should never feel really easy. It should be progressed to make it feel challenging for where you're at. And then there are some areas that we tend to focus on for people with Parkinson's. And so these are like our postural muscles, our extensor muscles in the back to help fight that forward stooped posture that can occur. Those muscles tend to become more inhibited. I saw a lot of people sit up taller right when I said that. And then also our hip extensors, so our glute muscles are really important, not just for like being able to stand up from a chair, but also to keep our posture more upright. And then calves are important to strengthen as well. For flexibility training, along with kind of our posture, we want to strengthen those, or to lengthen those muscles that tend to get tighter. So those are the hamstrings, the chest muscles. These muscles are the ones that kind of pull us forward into this position. And if the hamstrings are tight, they pull us down a little bit. And same thing with the hip flexors. So we want to try to open all of that up with our flexibility training. Strength training, I didn't mention, should be done around 2 to 3 times per week. And flexibility training, the goal is to try to do it every day, just a few simple stretches even. And then our last category, this is my favorite category, neuromotor training. And so this is kind of a broad category, but it encompasses our balance training, agility training, dual tasking, coordination training. So this is where we do things like our power moves, which I'll talk a little bit about in a minute. Also, our balance on different surfaces. So people with Parkinson's can have more trouble integrating the different senses that we need to help us balance. So it's important to practice balancing on all different kinds of surfaces, not just a firm ground. Also, boxing can be seen as neuromotor training. There's a lot of cognitive dual tasking involved in that, where you're thinking about your sequence of your punching. And then also multi-directional stepping is very helpful, especially if somebody is having difficulty with freezing of gait or initiating their gait. So where they feel like they're stuck to the ground or they're about to start walking and they have trouble taking that first step. Neuromotor training, we also try to do a little bit of it every day if possible. With these 4 categories, if you don't know where to start or you're not sure which to do or how to do them, the best thing to do is to see a physical therapist, and they can help prescribe this and then also help you with community resources to maybe do exercise classes or see a personal trainer to continue. There's all different types of other types of exercise: dance, yoga, Pilates, Tai Chi, playing sports, water exercise, just simply taking the stairs more often. Just whatever you can do to be more active is really helpful. Just a little bit more about the benefits of exercise. My vision isn't very good. I can't read this. So exercise helps to create brain change. That's what we talked about, how it slows the progression of Parkinson's disease. So it helps us to release neurotransmitters in our brain. The biggest one we talk about is called brain-derived neurotrophic factor. And so that's a neurotransmitter that helps our neurons communicate with each other, helps medications work better. It improves the binding of the receptors. So exercise creates actual changes in the brain, and that's called neuroplasticity. Exercise can help decrease stiffness associated with Parkinson's, or that rigidity that occurs. It improves posture. It can help to reduce pain. It can improve bowel function to help prevent constipation. It improves the motion of our joints, improves muscle tone, and just in general helps to enhance quality of life to keep you doing the things that you want to do. You'll hear all about all kinds of different exercise for Parkinson's. Like one of the big ones people hear about is rock steady boxing. There's no specific exercise that is like the best one for someone with Parkinson's to do. So the most important thing is that you just find one that works for you, that you enjoy doing, and that you'll regularly do. Even if it means maybe for a few months you do yoga and then you're sick of yoga and you move on to boxing. Just find something that works for you and try to continue with it the best you can. So just a little bit more specifically about physical therapy. So physical therapy has been shown to help slow the progression of Parkinson's disease based on the UPDRS motor subscale. So that's the assessment that your movement disorder neurologist would do with you, where you open and close your hand big and fast, and you lift your leg up and down big and fast, you walk, they pull you backwards and you catch your balance. So physical therapy has actually been shown in research to help slow the progression on that scale. The goal of physical therapy is to keep you active and independent as long as possible. It used to be that someone with Parkinson's wasn't referred to physical therapy right away, and maybe they were experiencing more trouble with their balance, or they experienced their first fall and then they were referred. But really, someone with Parkinson's disease, especially if they're not habitual exercisers, they should start physical therapy right away, even if it's just a session or two to get started on an appropriate home program. So physical therapy focuses on the physical rehab of people with the goal of restoring mobility. Physical therapists educate people on managing their condition to maintain long-term benefits. So a lot of times with the insurance-based model of therapy, someone with Parkinson's will go to physical therapy for maybe 12 visits and then they're discharged, but your physical therapist should show you what you should be doing in that time that you're discharged so that you can maintain those benefits. You don't want to do physical therapy, make improvements, and then lose those improvements and go back and start from scratch again. It also improves our gait, so our walking, our balance, posture, flexibility, strength, and also endurance, and helps to reduce pain. Okay, so power moves. We're going to do them together, but we'll go through this slide and then we'll practice together. So POWER stands for Parkinson's Wellness Recovery. It's a treatment method that was developed for people with Parkinson's to help combat a lot of the physical symptoms that people tend to have. So with Parkinson's, there's a lot of bradykinesia and hypokinesia, where there's that kind of slowness and smallness of movement that occurs. So power moves are amplitude-based, so we move as big as we can to help recalibrate movement and move easier. It focuses on these large movements. The moves target 4 critical areas that the disease tends to affect. So our anti-gravity extension, so fighting that stooped posture and getting up nice and tall. I saw a lot of people correct their posture again. It targets weight shifting, which is something that's really important for freezing of gait as well. Sometimes just simply shifting your weight side to side can help break a freezing episode. It targets axial mobility, so our mobility through our trunk, which is also very important for our arm swing with our walking. And then also our transitional movements, so getting up from a chair and being able to take a step. You may have also heard about a treatment technique called LSVT Big. This was developed by the same person who developed the power moves. Her name's Becky Farley. And so it's also an amplitude-based treatment method for Parkinson's. Power moves is kind of like the newer version of LSVT Big, but LSVT Big is still out there too. All right, so moving on to occupational therapy. So occupational therapists focus on enabling people to engage in their daily activities. So activities of daily living are things like bathing and dressing, eating and drinking, toileting, hand strength and writing. They focus more on kind of that fine motor control, meal preparation, performing housework, and just having the ability to continue to engage in hobbies that you may have. So things like gardening, sewing, painting, any of those hobbies that require more of that fine motor control too. And speech therapy. So speech disorders in an individual with Parkinson's disease are known as hypokinetic dysarthria, and speech that is slow, slurred, or difficult to understand due to muscle weakness. Almost 90% of people with Parkinson's will have a speech disorder. And this can manifest as deteriorating speech clarity, decreased voice volume. That's why we were talking nice and loud as we were counting with our power moves. A flat or monotone voice, a hoarse voice, reduced breath, or also lessened facial expression is something that a speech therapist can help with. So with speech therapy, you can do one-on-one speech therapy. There's different methods that we'll talk about, and then there's also group methods for speech therapy too. Early intervention is key for retaining speech. So one of the methods is called LSVT loud. This is the counterpart of LSVT big. So just like we think about moving as big as we can, we think about speaking with intent is what speech therapists are always saying. It's an effective treatment to improve vocal loudness in patients with Parkinson's. Patients attend 16 sessions over the course of a month, so it's done 4 times per week. And LSVT can help to improve vocal loudness, vocal clarity, and breathing. And patients are trained to focus on their voice volume and clarity, as well as the physical requirements of improving their speech. Speak Out is a program developed by the Parkinson's Voice Project, and this is to help preserve the voices of individuals with Parkinson's through intensive speech therapy and also follow-up support. It's done with 2 to 3 sessions per week for a total of 12 sessions, so slightly less demanding than the LSVT loud protocol. Sometimes you'll also see therapists who you don't have to follow the exact protocol, but this is what the protocol is. It emphasizes the use of intentional speech rather than automatic speech. So speaking with intent, like I mentioned. And then one thing real quick is I mentioned that there's one-on-one speech therapy, and then there's also group therapy too. So there's something called a loud crowd as well, which is a fun way to work on your speech and maintaining your speech in more of a group setting. All right, thank you.
So one of the first things that I did when I was diagnosed was went to see one of my speech therapist friends, because I knew that your vocal cords are more than just for speaking. They also help you swallow. And as a dietitian, I didn't really ever want to have to deal with a swallowing issue or have a tube feeding or enteral feeding as I progressed. So I did LSVT loud and then Speak Out and learned to speak loudly with intent. And, doing the homework that you have to do, you feel like you're really being silly because you go, A, E, I, O, U. And you have these sentences that you have to put intent and use your facial expressions on, but it's really a good thing. Physical therapy has been part of my life for my entire life because I had a congenital dislocation on my hip when I was born. But PT is invaluable to people with Parkinson's, and it really does help us, as does occupational therapy. Just wanted to mention the books that are over by Chris. If you didn't get one of these books, the Every Victory Counts books, there's a few still over there on the table. This book is developed and published by the Davis-Finney Foundation. Davis-Finney was a famous cyclist about 30 years ago. He rode in the Olympics and medaled in the Olympics, as did his wife. He also rode in the Tour de France, mostly as a domestique, but was pretty influential in that as well. About 25 years ago, he was diagnosed with Parkinson's and had to give up his career as a commentator because it was affecting his speech. So he formed the Davis-Finney Foundation, which is and their motto is to live life well with Parkinson's. Their mission correlates remarkably well with ours. At Parkinson's Association of San Diego, we say live your best life. I'm an ambassador for the Finney Foundation, which is why I have the books. If you didn't get one, you can order it. It's free from at davisfinneyfoundation.org. There's also a corresponding Care Partners book. I only have one of these, but it's very helpful for those of you who are spouses or partners of someone with Parkinson's. It helps you to understand what they're dealing with. So our next speaker is Irene Miller. She's been a care partner for her husband Pete for quite a long time, and she leads a support group up in Fallbrook, and she's going to talk about the role of the care partner.
I just read something about caregivers, and I just wanted to share that so I get these stats right. But this is from the CDC. So you know that you're not alone if you're here as a care partner. 53 million U.S. adults care for somebody, either a spouse, elderly parent, a relative, or a special needs child. That's 22% of adults here in the United States. So, yeah. So welcome. Closer? Is that better? Lady Gaga. I don't know if I can do that. I'm going to move over here so I can see the slide better. Okay, so the role of the caregiver is really important. You came here with probably somebody today, and your role with your partner is so important. First of all, you want to establish some kind of a relationship. You probably already have a relationship with that person, otherwise you wouldn't be here with them doing what you do. But that understanding is really important when you're diagnosed with Parkinson's. Not to assume that, that they want your help at this point, that they need your help at this point. But by conversing together and talk about what this looks like and asking is so important at this point when you're newly diagnosed. At this point, you're probably going to be more volunteering to help do things. The next most important thing is to educate yourself, because it's new to you, it's new to them. And there's a lot of great ways to educate yourself. There's wonderful books out there, magazines, caregiver.com. There's a lot of support groups that are out there, which I will talk more specifically about, to be a part of, to learn and educate yourself about Parkinson's. There's websites out there. Make sure when you do go on the website that you're going to a vetted site for Parkinson's. There's a lot of misinformation or bad information out there. So go to places like Michael J. Fox, Davis Finney, Parkinson's Association, San Diego. Those are some great sites with some great information and education for yourself. Mentorship is another way, getting a mentor, because this journey is different for everybody. They say Parkinson's is a custom disease and affects everybody differently, and the symptoms that impact you come at different times. You may not get all the symptoms. At some point you may get some of the symptoms, but it affects people differently, so when you get those symptoms, it's different. So it's important to talk to people that are like minds and find yourself a mentor. A great way to find a mentor is through the Parkinson's Association website. We have mentors for care partners as well as people with Parkinson's. So you're talking to somebody that knows where you're at and has been on that journey as well, has personal experience. It's important that you listen, like I said earlier, and watch, use your eyes, watch for symptoms, especially as the disease progresses. So important to help with treatment and to communicate with your doctor, your movement disorder specialist. I recommend Care Partners Journal. When you see symptoms changing, write it down, whether it's in a physical form in a notebook, or whether it's, on your phone, whatever way is comfortable to you, but journal that information. Because when you go see your movement disorder specialist once every 6 months, 3 months, depending, you may not remember what happened, 6 weeks ago. So it's important because they need to understand what's going on in your lives. So be their ears and their eyes and observe that. And mostly patience with yourself, patience for them. This is a we journey that we're on. And patience is just, I can't say enough. Understand that what's happening to the person with Parkinson's, what's happening to the care partner, equally affects each other. And the only way we can have successes is to talk and communicate and have patience with each step as we go through it. So that leads me to self-care as a care partner. When you get on an airplane, they always tell you, put your mask on first, then put on the mask of your care partner. That's really important that you, as a care partner, take care of yourself. You've got to make it a priority. It is not being selfish. It is a must-do. You can't take care of your partner 100% if you don't take care of yourself. What does that look like? I think we've covered some of those things already. This is nothing new, but just remind yourself, eating healthy, sitting down and eating a meal, exercising, getting sleep. And sometimes getting sleep is a joke. I can tell you right now, we've been on this journey for over 17 years. And at some point, maybe I'm going to have to look at getting someone to come in and be there so that I can sleep. That's what it looks like. And we have to be flexible and understand as the disease progresses that we have to be flexible and look at those things and what are our options. Your schedule, your interests, and your hobbies are so important that you preserve that. It's not being selfish. I personally like to make jewelry, and so I go to my little place to do that, and I just say, okay, to my son, I need an hour to get away. Or my paid caregiver that comes in, I need you here on Tuesday, and she's there. So make sure you're still participating in those things. Those things are important. If your state of mind is not in a good place and you're not doing things that you enjoy, you're not going to be able to take care of your partner to the best of your ability. Make sure, too, that you're staying social and connecting with your friends, because as Marty mentioned earlier, your circle of friends will become smaller and smaller as the disease progresses. So those that you are friends with today may not be your friends down the road. But it's important to establish relationships and keep those relationships going so that as things progress, you do have people that you can count on, that you can rely on. Recognizing symptoms of guilt and resentfulness, that's very, very normal. And being aware of those signs of depression and making sure you seek professional help when that happens. Something that I've been thinking a lot about or on this journey, talking to different ones about that have been on this journey for quite a while, is called anticipatory grief. And what is that? You can experience anticipatory grief at the beginning of this journey or later on in the journey, throughout the journey. And anticipatory grief not only affects you as the care partner, but it also affects your person with Parkinson's. When you're first newly diagnosed, you think about what don't I know that I need to know, and you worry about that. And as a person with Parkinson's, as the disease progresses, that anticipatory grief is, what am I going to lose? What will I be able to do down the road that I can do today? But again, be flexible. There are alternative things that you can do and things that you can do together, and that's so important. Find things to do together. One of the things that we just recently discovered is RX Ballroom, my husband and I. Love the music, it's so uplifting, and yeah, you learn the steps, which helps the cognition. You don't ever become a professional ballroom dancer, but you certainly have a lot of fun doing it. So find something, whatever it is, that you can do together. You know, there are groups now that hike together. There are groups that bicycle together. There are groups that do yoga together. But there's just so many things out there now. When we started on this journey over 17 years ago now, the new thing was our Rocksteady boxing. Now there are so many different choices, and try to do those things together when you can. Okay. Care partner resources. One of the things that's, you got a lot of information today, and you'll continue to get a lot of information as you go on your journey, but what's important is to gather that and put it in a toolbox. I call it a toolbox. Marty referred to it also as a toolbox. And whether it's a 3-ring binder or things you file on your phone, but keep those so that when you get to that point, you have them at your fingertips. You might not need them today, but at some point you will. And some of those resources, these are links that are out there and available to you. Southern Caregivers Coalition here in San Diego, Seniors Helping Seniors, Partners in Aging, and a number of various other ones. These will be on the websites themselves. The links will be live so you can go directly to them. This is one that I recently found, and
Are you a caregiver, an aging adult, or a care receiver who is throwing up your hands saying, I wish someone told me that caregiving would be like this. I wish someone told me that getting old would be like this. It's not what it's cracked up to be.
Pamela Wilson, and she does a lot of YouTubes. She is a CSA, which is a certified senior advocate. Been doing this for over 25 years and has some wonderful YouTubes out there that talk about all aspects of caregiving, so I recommend that you check those out. Another place to get some resources, of course, is on our website, Parkinson's Association of San Diego. If you go to the tab that says Living with Parkinson's, there's a drop down there where there's actually training for care partners, all different topics there. Some of them are things that you read, some of them would be videos. And then this part of caregiving, this is an acronym that I'd like to share with you. I learned about this in a research project that I was involved in through UCSD for caregivers. They were studying the impact of caregiving on people, especially caregiving for people with dementia. And this is an acronym that they had. I'm going to have to get a little closer to read it here. So you know the old saying, an apple a day keeps the doctor away. This is kind of on that same vein. Grapes. G for gentleness, be gentle to yourself. R for relaxation. A for accomplishments, make sure you're tapping into what you have accomplished. You know, it can be an accomplishment on a daily basis. It could be an accomplishment on an hourly basis as the journey progresses. But tap into those accomplishments because those are something that'll make you feel good. Pleasure. Do something that gives you pleasure, whether it's outing with a friend, whatever that looks like to you. Of course, exercise, we've talked about that. 30 minutes of cardio increases your endorphins, and those are your feel-good hormones. And then S, of course, socialize. Something that we adopted in our family, my husband and I, is DOTP. And he put that on his bathroom mirror when he was first diagnosed, and it's still there, the same piece of paper stuck there. And it stands for dwell on the positive. So make sure you're with positive people and dwell on the positive things of your day, the hour, or whatever it might be. Benefits of support, joining a support group. We talked about that. It's somewhere where you can go talk honestly and openly with people. There's no judgment there. You learn things, amazing things, things you share, sometimes really crazy things. One of the things that was shared with us, my husband suffered from neuropathy in the feet and was having a lot of problems with it. And one support group meeting we went to was mentioned in our breakout session. And a lady said, well, just take a bar of ivory soap and put it between your sheets at the foot of the bed. I'm like, okay, does it work? Well, it did work. I don't know why, but anyway, it worked. But we share little tips like that. Some of them are just, things that they're not medically necessarily sound, but if it works, right? And we share those things, those successes with each other. And we talk about our challenges so we can help each other with this as the progression goes. So how do I find a support group? Go to parkinsonsassociation.org, click on that tab that says support groups. There's a drop-down box that goes, you can see North County is the support groups that I'm involved in. I am the support group leader of the Fallbrook chapter, but we have them throughout North County. There are support groups in San Diego County, Central County, East County, and Riverside County. Those are all listed there. A listing of Spanish-speaking support groups, as well as care partner support groups. And then most recently was added atypical support groups. So these are support groups where the traditional Parkinson's meds don't necessarily help these people, but they are diagnosed with Parkinson's with other extensions on them, like Lewy bodies. Oh, and here we go. Thank you very much for your time coming today.
So we've talked a lot about the journey with Parkinson's, and you've heard a lot of things, but your life is not over because you've had this diagnosis. It's just changed a bit for both the care partner and the person with Parkinson's. I know a few of you in the audience, and I know you still travel, and you do the things you love to do. You enjoy your grandchildren, your friends. You still play cards or, bunco or all those different things that you might have done before. I'm going to Ireland next week with my college roommate. My husband's not going with me. He's going on a cycling trip up in San Luis Obispo. We travel. We go on 6-week road trips in our travel van pretty much every year and just go wherever we want to go. First it was because we wanted to do it while I still could. That may not end. I might be able to do it, for the rest of our journey together. It's really helpful to have a positive outlook and to know that your life is not over. It's just you're going to have to take some medications for that rigidity. I'm slower in my movements. I told my friend that I'm going to Ireland with that she said something was 6 minutes from our hotel, and I said, well, it might take me 10 minutes because I walk a little more slowly. So she said, well, just if I'm walking too fast, just tell me to slow down. And I'll have to be careful with those cobblestone streets in Ireland, because I might trip and fall, which she said no falls are allowed. So you just, be honest with yourself, realize your limitations and your restrictions and honor those, but live your life. Don't let it be over. Don't let this disease define you. You are still the person you were before the diagnosis, and you'll still be the person that you are throughout the rest of your journey. So, if you take nothing else from today, know that there's ways to manage your symptoms. Be honest with your physician, and then that should be a movement disorder neurologist. Be honest with yourself, and be honest with your care partner. And care partners, be honest with the physician as well. When I see my movement disorder neurologist, he talks to my husband as much as he talks to me, because I might forget something or not mention something because I don't want them to know that something might have happened. That's not usually the case, but they can help because you notice things that your partner with Parkinson's might not notice. We don't have great self-awareness of what our symptoms look like, so it's very helpful for the care partner to go to all those appointments. I'm going to introduce Chris Busher. He's our executive director. He's going to talk about the path of possibilities that you can go down with Parkinson's.
Can everyone hear okay? Okay, great. Okay, as Marty mentioned, my name is Chris Busher. I first want to thank all of you for coming today. I've had the opportunity to speak to many of you, and it's very, very special that you've come today. And my role is going to be to reinforce a lot of the information that you've already heard. I'm going to take us through our website, and I'm going to avoid information overload because you've certainly had a lot today, I know. The most critical thing for us to make certain that is clearly understood relative to Parkinson's, as was mentioned before, is really to educate yourself. We have assembled on our website an absolute truckload of information. I'm going to simplify it for us, then you can go on later on, and I really would recommend that you take your time and go through it all, because at some point in time,
You're going to either have to get shorter.
Okay. At some point in time, the information that we're going to make available to you could be very, very helpful. Okay, I've had the distinct honor of being the executive director for the past 7 years at the Parkinson's Association of San Diego. We're in business to help people in San Diego County. We do not do research. We partner with a lot of national associations, and our programs and portfolio of information and resources designed to help you here. All of the donations and income to our association stays right here in San Diego County. We don't do research again, and this is our purpose and function. From this point on, the speakers that you have heard, all of our support groups, Tremble Clefs, everyone in the back, from Sharp, Acadia, and everyone else that's here, we're going to be available to help you. From this point on our website, there's a phone number. That's my cell phone number. So from this point on, you know us, you know me now. Anything that you're going to need, just call that number, and I'll help broker it for you. We'll find out the answer so that you've always got our Parkinson's Association available to you. I'd like to introduce two special people that really do a great job here at the association. The first person is Jeff Seckendorf. Jeff, as you will see momentarily when I go through the website, Jeff is just absolutely terrific. And he's done a great job of organizing the programs and the information, interrelating with Marty, who's a superstar as our board chair. And we'll talk about one special thing that he did today that can be very, very helpful when I get to it in the chronology. Second person I wanted to introduce is my wife, Nancy Carlson. She's been our chief volunteer for the last 7 years. And she can help me out when I can't find out how to get the computer thing to work right, and why did this disappear, and so on and so forth. So in addition to that, with her professional background, she's exceedingly helpful and totally dedicated to the cause. We also have a person named Lizbeth Garces. Lizbeth, and I'll talk about this in a few minutes, Lizbeth is our Hispanic program liaison, and she does a lot of initiatives to help Spanish-speaking people integrate into the Parkinson's world for education. And our website is also in Spanish, and we have a phone number for her as well. So that's available. Okay. I want to talk about information overload for a minute. Now, it's 2:20. You've heard tons and tons of things that my previous partners have talked about. I'm going to talk about a lot of stuff. But what I want to make sure of is that the reason why we want to cover the waterfront is because down the road during the journey, you may never know when you need to know something. And by covering the waterfront and then your follow-up reading and research, you're going to be aware, especially of symptoms. And if you begin to experience a symptom, as was mentioned earlier, the most critical thing to do is to immediately let your physician know about it. That way they can address the meds, amelioration, have a different approach to it and so forth with other things. So that's most critical. So if symptoms begin, that's what you need to do. That's the first thing that you need to do. And all the information on the website can give you that knowledge base so you'll be able to identify symptoms and change. Okay, in terms of the website, it's a path of possibilities. Here are all the possibilities, starting now. The first section of our website covers our walk. We have a huge walk every April. We have about 1,200 people attend and walk. We also have over 65 exhibitors that come to the walk. They're all the pharmaceutical companies and everybody else that is in business to help people with Parkinson's. We did something special this year that really worked out well. We had all of the deep brain stimulation organizations and entities there in the same area, along with focus ultrasound. And that really made it easy for people to associate and assimilate with that as well. So that's the walk. The next thing is our mentor program. Now, it was mentioned earlier. This is on the website. You see all those head photos there? Those are head photos of 25 people who have volunteered their time to help everyone in this room. They're free and they're confidential, and all you have to do on the website is click on the photo. Up will come their biography, and you can find somebody that may relate exactly to your background, your lifestyle, and why not avail yourself of a mentor right away or down the road if you'd like. It's your choice. Again, they're free and confidential, and they're all have volunteered to help. So make sure you take a good close look at the mentor program and all the individuals that are there. Okay, oops. Okay, the next thing is called a microcast series. And I mentioned about Jeff. One of his roles is to constantly interview experts about Parkinson's here in San Diego County. And the reason we do that is so that we can keep current and up to date on anything that can help throughout the journey. Anything, he does it all the time. He did a very special one today with Dr. Chavakula from Sharp, and also Jason Lakis is here, and Belinda is here from Sharp. Jason works for Focused Ultrasound, and that is a terrific new thing that is happening to really help with Parkinson's. And you can see the interview with Dr. Chavakula right on our website shortly. And it's a very special thing. Jeff does other things. You've got 92 microcasts on the website, and all you got to do is click. Some are 2 minutes, some are 5 minutes, some are 10 minutes. But scroll down through the entire litany of topics, and if something is, you need some information on something, that's a good way to start. Jeff and his wife, Sherry Gould, nurse practitioner at Scripps Hospital, they also every year take a group of individuals who have Parkinson's and their care partners and interest people, and they go climb mountain ranges throughout the world. And this year they just got back from a trek in Japan. You can see and hear all the travels that they went through on the website and under microcasts as well. Okay, next item. Well, okay. Okay, care partner education. Irene Miller did a great job on care partnering. What we have here on the website is a complete compendium of videos and other information that will really, really be helpful if you're going to be functioning as a care partner. So you want to make sure and take the time, listen to the videos, go through the information, and we update that quite regularly, and it's all right there for you. Okay. Next item. There. Okay. And by the way, it's 2:25. We're scheduled to end at 3 and then have question and answers. But I'm going to end within the next 15 minutes or so, and then we'll have plenty of time for question and answers because I know that that's one of the critical things and components that we're going to have available today. So we'll move to that as soon as possible. Okay, the next item, and Irene covered this, and I'll show you where this is on the website. Here are all the support groups, and you can see them all, and on the website, all you got to do is click on it, and then up comes all the information about the support group leader, the times that they meet, where it's located, and other critical information. And, you know, as we've talked earlier today, one of the best things that you can do immediately for those that are recently diagnosed is to identify a support group and join the support group. Having spoken with hundreds and hundreds of people over the 7-year tenure, that's one of the best things to do, and people are so happy and so pleased that they're able to join the support groups. And as soon as we finish, we obviously have support group people here as well. Okay, next item. Support group leader training. This is the training that we put together for the support group leaders so that they've got a basis and background in order to provide the best leadership possible. And again, all the meetings and the calendar are right on the website. We have a speakers bureau available if anybody needs a speaker. There are 6 of us so far. All you have to do is go on the website, click on it, get in touch with us, and we'll be a speaker. So that's really, really easy. Okay, Resource Center and Information Referral Line. As I mentioned, the phone number that's on the website, that rings on my cell phone right in my pocket. And I will answer the phone immediately or as soon as possible after it rings. The same thing with emails that come into us. You're not going to have to wait very long. You've got something you need to know more information about, we'll be the broker. We'll get the answer for you so that you can move on with whatever you'd like to do. So that's our promise to you, and we'll be available full time to be able to do that. Okay, next thing. Also, there's many, many more, as you can see, topics that are there on the website that you can access on the website and click on. Okay, this next thing, Community Reference Guide. This is very, very important. What we have done is we have put together this reference guide for you. What this contains is every known conceivable organization, business, service, and entity in San Diego County that is in business to help someone with Parkinson's and or their family members and care partners. So you don't have to go on an Easter egg hunt if you need something. It's all right there. We've got the name, the topic, the explanation. We've got the phone number, the email address, and everything. So it's all right there. If there's something that isn't there, and you know about, just let us know and we'll add it. So this compendium is there, and it's very, very comprehensive. DBS Corner, this is where we put all current information and update for deep brain stimulation. So if you're contemplating that now or in the future and so forth, this is a good place to start, and the reference information is there. Focused ultrasound information will be there as well. Okay, we're on Facebook, YouTube, Instagram. We're also on the IN, which is what, Jeff? LinkedIn. Okay. And you'll see over on the left it says free mobility devices. If you ever need any type of mobility device, all you have to do is call that number. We have a relationship with Harmony Home Medical Services on Claremont Mesa Boulevard. And people donate literally every day. There's a phone call. Somebody's got a wheelchair or walker. Somebody called last week. They had 5 brand new unused wheelchairs. So if you ever need a mobility device, all you have to do is call that number, go down, and you can get the device for free. And of course they're donated, they're used, but they're good used. And you may never need to use that service, but if you know of somebody that does, somebody that has Parkinson's, all they got to do is call the number, go down, and they can get it for free. Okay, this is another critical program that Jeff and Marty created. And it's called the Parkinson's Education Program for Mental Health Professionals. We've established a relationship with the Zur Institute, which is in Northern California. And the purpose of this program is to increase the mental health base and knowledge of professionals here in San Diego County. Although anyone worldwide can avail themselves of this program, the initial design was here in the county. So what we have here, it's for movement disorders, MDs, neurologists, nurse practitioners, neuropsychologists, clinical psychologists, social workers, anybody that needs to enhance their mental health understanding relative to Parkinson's. And it's very, very important. So we're playing a lead role on that and marketing the program accordingly. And many people have already taken it here in San Diego County. So what we're obviously trying to do is to create more understanding from the mental health perspective and how it interrelates with Parkinson's. Okay, this is our Spanish website. As I mentioned, Lisbeth Garces is our Hispanic liaison. We have had 2 major events down in South County over the last 10 months. And there's a phone number there for her. So if you are Spanish speaking and want to speak to someone who also speaks Spanish, she'll take it from there. She runs a Spanish speaking support group. And that's our dedication to the Spanish speaking population in San Diego County. Okay, you mentioned the walk earlier. It's going to be the first Saturday in April next year. April is Parkinson's Awareness Month. So, 1,200 people, 60, 70 different exhibitors and so forth are there. This is the golf tournament. We just had our golf tournament on Monday. It was completely sold out. It's a fundraiser. So we're very, very pleased with all of the support that we got. And as I mentioned, all the support that we ever get through donations, fundraisers, grants, and everything stays right here in San Diego County so that we have the ability to provide services here. Okay. I'm almost done, and then we're going to have almost, plenty of time for question and answers. Okay. The program in the middle is called Empowerment Day. And Empowerment Day is a terrific program that we put on. I see some people nodding their heads that they've attended. It is a day-long symposium that has 15 speakers, all by design, 15 to 20 minutes. They have a myriad of topics, and we also have breakout groups to cover all the critical programming as well. And it's a very positive event. People come and they just enjoy themselves. They learn, they educate, and it's just a terrific event. This year it's going to be on December 4th, which is a Wednesday, and it's going to be at a new location, and that will be the 4 Points Sheraton, which is located on Kearney Mesa Drive. Now, the reason I'm forecasting this now, because you'll start seeing information about it, is that that's all the speakers that spoke in last November. And the agenda is there, and all of their speeches are right on our website. And when you get a chance, just peruse them. Take a look. Oh, yeah, I wanted to know more about that. All you got to do is hit it, 15, 20 minutes, and you've got updated information. Okay? Okay, these are all of the different entities that sponsor our Parkinson's Association. Just about every pharmaceutical company sponsors us. Sharp was the sponsor for our walk. Acadia is going to be the sponsor for Empowerment Day. And you can see all the others there that just about every, again, pharmaceutical company entity in San Diego County that has something to do to support Parkinson's. Down at the bottom are all of the national organizations. And when you go on the website, notwithstanding everything that we've just gone over, if you click on one of their logos at the bottom of the website, it will take you right to their national website. So you can see and hear even more information from a national perspective that you can interrelate on a local basis. And then the last thing is eBlast sign up. We're going to sign you all up for your eBlast sign up. What we do is each week we send out an eBlast that really updates you on all the most new and most current information relative to Parkinson's that we have here in San Diego County and elsewhere. So we'll sign you up unless you don't want to be, but just let me know. So before I turn it back to Marty for the closing, we're going to have question and answers, and then we'll be here. You know, anything you need, just let us know. And before I do that, is there anything that I forgot to mention? We're good? Okay, well, again, thank you so much for coming today. It's really special that you came, and we'll be here for you whenever you need us.
Yeah. One more save the date event for you. The Michael J. Fox Foundation is going to present their PD, IQ, and U event on September 21st at La Costa, actually it's Omni La Costa Resort and Spa up in Carlsbad. It's from 9 to 3, so there'll be a lot of exhibitors there, and they're going to talk about building your care team and then updates on all the research that they're doing. They are also looking for people with Parkinson's and care partners to join focus groups for their organization. So if you have any interest in that, just let us know and we can connect you with the right person at the Fox Foundation. So I'm going to invite Irene, Jesse, Dr. Wright back up to for questions, any questions that you might have, and hopefully we'll be able to address everything.
I was recently diagnosed with Parkinson's 2 months ago, and I have Kaiser for my insurance. So I have my first appointment with the movement disorder specialist on Monday. What questions should I be asking?
Well, I know that, is your doctor Dr. Sepianini?
She is not currently. I have to ask for a second opinion.
Okay. But are you going to see her? Oh, great. So she's a specialist. So, well, I mean, obviously you should ask her if she agrees with the other doctors that have made the diagnosis. You're going to tell her your symptoms and everything that's happened over time, and she will do a physical examination on you, and she'll tell you if she agrees or not. And, I don't know if, I would assume that if you've just been diagnosed, you haven't taken any medication, but you might want to, okay. Well, you might want to ask her, do you think I need these medications? Do you agree with these medications that I'm already, taking? And I'm sure, you can just ask her anything else that she recommends. I'm sure she's going to say she recommends all the things we were talking about today: regular exercise, good sleep, drinking plenty of water, balanced diet, ideally Mediterranean diet, but, balanced diet. Okay.
So should I ask her to take me on as a patient, or should I remain with the current neurologist that I have?
Well, it's up to you. If you have an appointment with her, you're her patient, so it's not like she has to accept you or anything like that. You're already her patient, so you can decide if you want to. Like what some people do is if they have a general neurologist that they like, and maybe they have other issues like migraine headaches or something, they'll see their general neurologist every 3 months or so, and then they'll see their movement disorder specialist every 6 months. But it really depends. You may find that you like Dr. C and you mesh with her personality really well and you want to stick with her. So it's really up to you. What I would say, though, with regard to medications for Parkinson's, you really should only have one cook in the kitchen. So if you decide to to go with both of them, I would always let your movement disorder specialist know any changes your other neurologist is thinking about doing, because it's good to only have one chef. So
I would also ask her for a referral to physical therapy, just to have an assessment and see if they want to do a short course of therapy. Good. Yeah, so it's important to find a physical therapist that specializes in treating Parkinson's. Oh, okay. Does he do power moves or LSVT big? Okay. One thing that you can look for too to find someone that specializes is a PT that is a neurologic clinical specialist. So at the end of like their name, it'll say DPT for Doctor of Physical Therapy and then NCS. And then it's a little more of a guarantee that they'll really specialize in working with you. Neurologic clinical specialist, NCS. Yeah.
I think you just answered the question I have about finding the right match in a physical therapist.
Mm-hmm.
What do you look for, to make sure that you don't do more harm and good by, hooking up with someone who does not have the expertise in PD?
Right. So that's a really good question, because not all therapy is created equal. So the American Physical Therapy Association, there's the Neurology Academy of the American Physical Therapy Association, and you can search for physical therapists there. And that's a way to find a therapist that is an NCS therapist. And then another option is if you go to the Power Moves website, I think it's called powerforlife.org, you can search a directory of therapists that specialize in power moves that are certified in that as well. But the biggest thing is just to make sure that you're feeling really challenged in your physical therapy. Like my patients that are here today too will tell you that the exercises are very challenging, and if they're not, then it's not doing a lot for you. I think a lot of physical therapists will do sit to stands and bridging and some general strengthening, but you want to make sure that you're really working hard, and if something's feeling too easy, they're pushing you to the next thing.
Okay, I'm a newly diagnosed Parkinson's patient for about 9 months now, and I've seen 3 neurologists at the VA, and all 3 have different numbers on my assessment. Is that a normal finding? Should I continue to find somebody to go on the journey with me because I'm not going to get it at the VA. I don't mean to badmouth it. I need a partner in this because I'm.
Well, I'm not.
Frank.
Are you going to the VA up by UC San Diego?
Yes.
There should be some good movement disorder specialists up there that they go to that clinic up there. I'm not really sure, but anyway, because there's some. I mean, several of the UC San Diego faculty actually see patients there too.
That's what I saw, but I also see the other two were residents.
Oh, okay.
Because I was deferred by the neurologist.
I see.
So I have no idea what my true numbers are.
Yeah, a resident is not going to be the best.
Thank you.
Hopefully that resident was being supervised by an attending doctor that at least could ask them what they were doing. But a resident is not going to have the
They
training
didn't want.
in Parkinson's. Now, it is true that residents need to learn about Parkinson's. So it is important that they work in these clinics. Otherwise, if they don't end up being a movement disorder specialist, they need to have some training. And that's probably what their idea was for having the residents work with you. But you should have one attending that you're seeing, unless it's. I think there is like a neurodegenerative clinic up there in the VA, and I think it's a rotating thing, and that can be frustrating sometimes the way that the VA works. But I would make sure that next time you get that you actually see the attending. If it's just a resident, say I want to see the attending.
Okay.
And some of these attendings will see patients in their own office across the street in UC San Diego. And if you want to be seen in that setting, ask them if.
I think I'm going to have to change.
Yeah.
Neurologists.
But there's, I guess if you're not finding the right fit with the VA, there's 6 movement disorders doctors at UC San Diego. There's 4 at Scripps now.
Wow.
Dr. Noel at Sharp. Kaiser, and then Neurology Center, Dr. O. So there's a lot of options around town.
This is a twofold. The second one is there a rebound effect from these drugs? Because I was given a med initially and taken bad side effects, and then it felt like all my symptoms were doubled after that. Is there some sort of rebound effect that I can't find it in any of the literature?
Well, what I would say is after years of experience, anything is possible with the way that people react to medications. Everybody's body is different. Some people can have side effects that are very strange, but they happen, and that's just the way their physiology interacts with the drug. So certainly it's possible. Yeah, you could, if the medicine doesn't agree with you and maybe your body is physiologically stressed from that, then your Parkinson's symptoms will be temporarily worse. So.
Hi, my name is Jenny, and I was diagnosed 3 weeks ago. And my question relates to, I understand that everyone is totally different, but in general, is there a range where you can expect to be looking at DBS and the ultrasound? Is it roughly after 5 years, 10 years? I mean, just some idea.
It's, as we talked about, people progress at different rates. They have different symptoms. There's some people that go 20 years that still don't have DBS. There's some people that need DBS in the first few years. Usually they might have a lot of side effects or be very sensitive to medications, which would cause that.
But don't you have something for the lion's share of people coming in for these?
It's usually about 5 years. After the 5 years of symptoms, that's the greatest number of people are starting to think about it around then. But there's exceptions.
Thank you. And a question on nutrition. On this slide, it showed caffeine, green tea and black tea. I guess I misunderstood. I thought no caffeine.
Caffeine can cause some similar symptoms to Parkinson's, like tremor and anxiety. So if you have those symptoms, then you might want to moderate your caffeine. The green tea and black tea have antioxidants, and then that's why it was listed on this slide. And to your DBS question, I have a type of Parkinson's that was very, very robustly responsive to medication. I only took one pill twice a day of Cinemet, and I was extremely dyskinetic. So I was referred for DBS a little sooner because of they couldn't increase my medications to manage my symptoms. So that's why I was referred sooner. We're all different.
Thank you so much.
First of all, thank you for everybody. It's really incredible resource and appreciate it so much. I was diagnosed with Parkinson's a year ago, and I have two questions. I've recently heard that glutathione has been, quote, people with Parkinson's do well on glutathione. And I wondered if there's anybody here who knows more about anything about that in terms of research.
Well, I can tell you, at least right now, there's no definite research that proves that these glutathione infusions are helpful. They did some studies years and years ago, and they could not conclusively find in placebo-controlled trials that it helped. Now, there's certainly people out there that have had anecdotal experiences where they've gotten treatments and they felt a lot better. When we make recommendations to the general public, we have to basically go on based on what the research shows. And so, at least for everybody, we can't recommend it right now and say that it's definitely going to help. But there's a lot of research out there for these type of things.
Okay.
Hi, yes. My question is about deep brain stimulation, the surgery, and the good outcomes, the bad outcomes. And where can I go for getting resources so I can learn as much as I can about it?
On our website, parkinsonassociation.org, there is a DBS corner that has a lot of good information about deep brain stimulation. Also on the Davis Finney Foundation website that I mentioned earlier, dpf.org, there's a lot of information and webinars and other podcasts about deep brain stimulation, where they bring in a movement disorder neurologist, the surgeon that does the surgery, neurosurgeon, a patient. I was on one of those. And then they just talk about how it can be beneficial. They talk about who's a candidate, who might not be a candidate and ruled out, who might be better served by focused ultrasound, those types of things. And then what's involved with the surgery, the workup that you have, it's pretty intensive. And then what you might expect afterwards and the programming. And it takes time to get to the sweet spot, if you will, of the programming that will help you the best.
The empowerment program in December, early December, will have a couple of speakers on DBS, on focused ultrasound. We'll have a surgeon there. So there'll be lots of resources at that one-day event, Empowerment Day.
We're also going to have some information about pluripotent stem cell transplants. That's just started in San Diego County at Scripps.
Anything?
Thanks to all of you for coming today. It took some courage to come and some, I'm sure there was a little anxiety coming into the meeting, learning what we've taught you today. We'll be around for a little bit after the meeting, so if you want to ask us a question individually, that would be great. And if I can say anything at all, live your best life. Don't give up on living a good life, a positive life, and a long life. Thank you.
Thank you. Thank you, everybody.